4 minutes.
Yeah, thanks very much, Minister. Following on from your statement at the Dáil yesterday, and obviously the very real concerns of the people of the North West region, I have a few very specific questions that I'd like specific answers from. First of all, in your what you said yesterday, leads me to put down today's motion, which very specifically says that I'm asking you to confirm or deny the existence of a draft or preliminary report on maternity service in the HSE West North West Hospital grouping area as prepared by Consultants Health Partnership. I want you to outline the terms of reference provided for the preparation of this report. I want you to outline the report's draft recommendations, specifically in terms of the number and location of maternity service centres in the region, and to clarify the government's position on the matter. I have reason to believe that that draft report very specifically says, notwithstanding that there may well, and I pointed out, and bringing this into the public domain as well, that it's a draft report, that the preliminary recommendations of this group for consideration state that 2 are to be maintained, 1 in Galway and one in Donegal. So if you would very specifically say that, and I know no decision is made, but I want to get to the bottom of this preliminary report. And I hope that you can specifically answer those questions. 1, does the preliminary report exist? 2, what were its terms of reference? 3, what do the draft recommendations say? This company health partnership I tried to contact, they've got a virtual office down on Trinity Street. I spoke to one lady there today who directed me to the HSE CEO to answer any questions that I have. I don't know anything about this organisation. If you look up their website, it doesn't say that any personnel work there. The lady I spoke to said that there were 4. Obviously, your commitments that were given yesterday at a very worrying end, because you said that they would be that a national review was taking place, now notwithstanding the preliminary report that I want detail on, that a national review was taking place, and this would be determined by national, not local concerns. Now you'll understand that the people in the North West have an issue with yourself and your government on the basis that they were lied to in the past, in writing by yourself on Roscommon Hospital. They were lied to by Taoiseach Gilmore on things like cancer centres of excellence. They were lied to by Minister Kenny, or Taoiseach Kenny, on things like Roscommon Hospital as well.
Have rules around using the terms lies and vulgar liars.
We probably need to temper that language.
No, we don't need to temper it. And in fact, what I'm doing is I'm taking advantage of what's called parliamentary privilege to tell the truth. I'm not abusing privilege, but I am using it to say, you lied to the people of Sligo, the Taoiseach lied to the people of Sligo, Taoiseach Gilmore lied to the people of Sligo, and the people of Roscommon. And what I'm saying is, I have an issue with the commitment you gave yesterday being truthful, because I don't accept it as being enough. So what I want is the detail of the preliminary report. I want the terms of reference given to Health Partnership, and I want to know what their draft recommendations are, because the people of Ireland and the people of the North West region are entitled to know that if Fine Gael and Labour are secretly intending to dismantle the maternity services of the North West, they're entitled to know what the terms of reference to do so entail. For example, the first term of reference that ought to be given to any consultants group for the delivery of any health service in this country ought to be, the first one, ought to be that services are delivered on a geographical equality basis. That has not happened in the past, despite your lies on cancer services by you and your colleagues. And again, I do understand I'm using parliamentary privilege, but most certainly
that's not the idea
using it
parliamentary privilege.
It's necessary to put on the record the fact that you did tell lies in that regard. And as a result, we do have very grave concerns about your commitment yesterday in the fact that you didn't issue denials that a preliminary report exists. You didn't issue denials that that preliminary report's recommendations sought to shut down 3 of 5 services in the northwest of the country. And as a result, we need to see terms of reference. And this group with a virtual office down on Trinity Street need to make available to us the preliminary report in the people's interest, and more to the point, the terms of reference on which they've drawn up that report. Thank you.
Thank you, Senator. Minister, if you'd like to respond.
Yes, I have a written response here, but of course, that was before the Senator got up and made these outrageous statements about lies. The people of this country know who told them lies. Your government, and your government that brought this country to its knees. So I'm not going to sit here, Senator, and take a lecture from you.
I want you to sit there. I want you just to answer the question.
Minister, without interruption, please.
I just want you to answer the question.
Reports of your performance earlier on today, and clearly you're still on the same form. So
No,
I'll
I'm
just
interested
make
in
it
the
very
people.
clear
I'm
to you.
interested in getting the answer.
Can I,
Make it
answer
the
the
Minister, without
question.
interruption, please.
Well, yeah, if I was given an opportunity to answer, I would.
No, you want to give a lecture about the last government. The people voted on that. Threw them out.
Senator-
You're in the seat now.
Senator-
Answer the question.
Senator, you have spoken. I'll have to ask you not to interrupt the Minister, please.
Well, if you could direct the Minister to answer the question.
I'm-
I don't need a lecture of why the people voted the way they did. I know, pal. And you know.
Senator, you've had the opportunity to speak.
The
If you
upper
could
house
please
is
give
not
the Minister the
associated
time.
with this usual kind of calling people pal, but however,
Well, Minister,
Senator,
welcome
you're-
to the
you're-
free world.
you're-
Answer the question.
You're going to have to let him answer the question, Senator.
yeah, I think that would be the first part of getting an answer, is to be able to listen rather than continually interrupting. The reality here is that there have been media reports suggesting that some hospitals within the West Northwest group were to lose their maternity services. These reports are purely speculative and have no basis in fact. And I fully recognise that such unsubstantiated reports are a cause for concern for patients and staff, and I very much regret any upset which may have been caused to staff or patients in the region. It's not helped, of course, that they're further undermined by the likes of Senator MacSharry stirring it up into a sense of hysteria around the issue.
King.
The position is that in the context of the implementation of the HICWA report into the death of the late Savita Halappanavar and the Higgins report on the establishment of hospital groups, the West Northwest Hospital Group is currently undertaking a review of maternity services within the group. This review includes the maternity units at Mayo General Hospital, University Hospital Galway, Port Yunkla Hospital Ballinasloe, Sligo Regional Hospital and Letterkenny General Hospital. The review is in the very early stages and will take some months to complete. I'm informed that a draft report exists. I'm further informed that it makes no recommendations in relation to the closure of any of the 5 maternity units within the hospital group. The House can be assured, and I'm happy to provide assurance, that any decision on maternity service reconfiguration will be considered in the context of the development of a new national strategy for maternity services, which is currently underway at a national level. No decisions on service reconfiguration will be implemented without the agreement of my department, and certainly not in advance of the publication of the proposed national maternity strategy. The development of this strategy is currently underway, and it will determine the optimal configuration of maternity services to ensure that women in Ireland have access to safe, high-quality maternity care in a setting most appropriate to their needs. It's my intention to publish the strategy later this year. As part of the development of the strategy, maternity services in all parts of the country, and not just the West, will be reviewed and evaluated. The House may recall that one of the recommendations of the HICWA report into the death of Savita Halappanavar called for a review of maternity services nationally, and I accept that report. In addition, the Higgins report on the establishment of hospital groups requires that each hospital group prepare a strategic plan for service configuration consistent with national objectives for delivery of patient services. To conclude, I think we should welcome the review and look forward to similar reviews throughout the country. Such reviews will inform the national maternity strategy and help us identify how we can improve the quality and safety of care we provide to women and their babies and ensure best outcomes for women and their babies. Thank you.
Thank you, Minister. Senator.
Yeah, just to conclude, can I say that you have confirmed that there is a draft report. You haven't confirmed what the terms of reference are. So, I mean, if it's as benign as you say, why not publish the terms of reference that are given to this health partnership group to put the minds of those people at ease? And in addition, publish the report, the preliminary report itself, so that the people of Ireland can get a taste of what their future holds in terms of the health services that are provided to them in the context of maternity services.
Thank you, Senator. Minister.
Yeah, well, I'm informed the House that today I've met 2 of the chairs of 2 of the new hospital groups that we're acutely aware of the need to make sure that services are delivered as near to home as possible in the most cost-effective fashion, but that these services are safe. And that will be a benefit of these hospital groups and that will allow buddying up of services. So rather than services closing, smaller units will have the support of the bigger unit in the hospital group to ensure that they can deliver a standard of care that is safe, efficient, and will deliver best outcomes for patients, mothers and babies. Thank you.
Thank you,